Having seen the management and the approach to a patient who has got ST elevation MI, especially with the pharmaco-invasive therapy which can be applied in many of our centers where immediate PCI may not be possible. So we look at the next acute coronary syndrome in the form of non-ST elevation ACS. We already told you non-ST elevation ACS due to a plaque erosion. The basic pathology is a plaque erosion which exposes some content of the lipid core, content of your plaque to the circulation. So predominantly in non-ST elevation ACS, platelet gets aggravated. Because platelets get aggravated, platelets aggregation is happening, platelets gets activated. You get a thrombus which can be critically occluding, which is rich in platelets. So most often non-ST elevation ACS is because basic pathology is plaque erosion, critical occlusion, and also white thrombus which is rich in platelets. So this is the pathology. How these patients will present in your day-to-day life or in your clinic or hospital, they will have, because of the critical occlusion, they have an injury predominantly confined to subendocardial area. So because of the subendocardial, as I told you, the endocardium is the most vulnerable for the ischemia. If it has got injury, it will start in subendocardial region. So the subendocardial injury will produce ST segment depression. So this ST segment depression means when the patient comes with acute chest pain with a ST segment depression means we are dealing with non-ST elevation ACS. What is the pathology? Plaque erosion, critical occlusion and not total occlusion, platelet-rich thrombus rather than fibrin-rich thrombus, which is white thrombus. That's why in these patients, you never give a thrombolytic therapy because the thrombus is not totally occluding. Thrombus is not rich in fibrin, so the coagulation system is not activated. Here, there is no issue to give the fibrinolytic therapy. So here you manage with the patients with apparent dual antiplatelets and risk stratify this patient to decide about the conservative management versus interventional management. So this is a basic understanding of non-ST elevation ACS. We have already told you the differentiation between ST elevation and non-ST elevation ACS. So just we look at what are the characteristics of non-ST elevation ACS.